Natasha. I am Kiraka Wynn, and I am the Charitable Partners Coordinator, which is also known as the Chair, and I will be your host for today. To get it started, Denise is a committee member, and she's going to be sharing the presentation today. So Denise, could you begin to share the presentation so we can give a rundown of everything that you will be hearing from our fabulous speakers today? Denise, I don't see the presentation.
Okay, hold on 1 second.
Okay.
Hold on 1 second, Kim.
Okay. And while she's doing that, I'm just going to quickly go over the topics of discussion. They were on our flyer that you received. First, we're going to have a presentation from our representative at the American Heart Association. As you all know, yesterday was National Wear Red Day, and I hope you wore your red and showed your support. Our first presenter will be presenting on the Go Red for Women movement and controlling your blood pressure. And then we're going to move into a perfect topic, and speaking of health, which is on healthy food demo and presentation. She's a lively speaker and has been partnering with us for about 4 years now. And then we're going to move to the social action component of our program. Delta Sigma Theta is all about social action, and we're going to be speaking about what do we do in regards to diabetes. And then with diabetes, as you know, medication is a component of all of these chronic diseases. So we have a pharmacist on hand who will be speaking on know your medicine and what is going on right now, vaccinations. And then since you've been sitting in your chairs for a while, we're going to have a stretch break that is led by one of our committee members who's also a Zumba instructor. And the questions that you submit when you registered for our cardiologist, she will be responding to those as well as providing some more vital information. And then we will have the Q&A session facilitated by Mary McCullough. And those will be the questions that you submit using the links that were provided for each presenter. And then we'll conclude the program.
Natasha, if you can assist me with showing the presentation, for some reason it won't allow me to do so.
Yes, sure will.
Okay. So if you can go to the first cover slide for the first presenter. And Monica Dean is going to be introducing our first presenter. As I indicated, she is the Charitable Partners Committee co-chair.
Hi, good morning, everyone. I have the pleasure of presenting or introducing rather our first presenter, Veronica Sanchez. Veronica is the Senior Director of Healthcare Systems and Community Impact at the American Heart Association. She also serves on the CEO Diversity Advisory Cabinet under the leadership of Nancy Brown. In addition, she is the president of the Military and Veteran Employee Resource Group. She is committed to building community and creating equitable systems. Veronica has worked at the American Heart Association for almost 7 years. Veronica is not only an employee of the American Heart Association, but she is also a heart survivor after suffering 2 heart attacks and undergoing life-saving heart surgery. She has shared her story nationally, locally, and is passionate about creating awareness about heart and brain health through multicultural educational events like Vestido Rojo and Go Red Girlfriend. All right, Veronica, thank you, and we look forward to your presentation.
Thank you. Good morning, everyone. Is everybody sporting and rocking their red today? I hope so. Thank you so much for the opportunity to come and share with you a little bit about what we're doing at the American Heart Association for American Heart Month, as well as talk a little bit about our Go Right for Women campaign. This February, we are uniting for American Heart Month to help women, or just everyone really, reclaim their rhythm, because losing even one mother, sister, or friend, or neighbor to cardiovascular disease is too many. How many of you have gone out to the doctor? I know we've been a pandemic, and a lot of people have not been able to go to the doctor, and so we're asking everybody to kind of go back. But I wanted to give you some statistics first. Did you know that heart disease is the leading cause of death in women in the United States? In fact, 1 in 3 women will lose their life to heart disease. Women of color bear the burden of the disease. Black women have a hospitalization rate of 240% more for heart failure. 240% more. So that means that we have to be more aware of the signs and symptoms, which I'm going to share with you today. And we need to be more aware of things that we need to be asking when we go to the doctor. Next slide, please. So are you ready to go red? I hope so. We can't hear the video. I'm sorry. We have a beautiful video that I'd like to share with you. We might be having a little bit of technical difficulty. We just need to add the sound. Thank you. When you share, there's a little button for to add.
Sir, I'd go straight to the studio and dance my little heart out. I would take up the guitar again because I have always wanted to be a rock star.
I would love to spend more time laughing.
I'd empower women to move.
I would do more of what I want to do and less of what I have to do.
If I had more time, I'd give it all to her.
If I had more time.
If I had more time.
If I had more time.
In 2008, at the age of 37, I suffered a heart attack, and I never saw it coming.
At 10, I was diagnosed with dilated cardiomyopathy, and at 22, I had a heart transplant.
Thanks to research funded by the American Heart Association,
so many of us have been given more time
with our families, more time with our dreams, and more time to accomplish the things that cardiovascular disease tried to take from us.
And we're not going anywhere.
What would I do if I had more? What would I do if I...
So, more time. As you heard in the introduction, I am also a heart survivor, and I too asked for more time when I was in the hospital after suffering 2 heart attacks, and wanted to just, made a plea to God and said, hey, if you give me more time, I promise that I will make good use of it. And that's when I came to work for the American Heart Association. And so the American Heart Association has a focus. While we've always focused on heart health, but 18 years ago, we actually started a movement specifically for women, because when women need treatment, our bodies, our physiology is very, very different. And so we need to be treated a little bit differently. We can't be treated the same way a man does because our body's not the same. The medications are not going to be the same. And so it's very important that research is done so that women can be treated accordingly. And so Go Right for Women is American Heart Association's signature initiative to raise awareness that heart disease is women's greatest health threat, to empower them to take action to lower their risk. And we started this campaign in 2004. Next slide. So what this campaign, in the 18 years, you can see that we have made many, many advancements. But at the end of the day, it's all about raising awareness among women, empowering women to take charge of their heart health, engaging more women to enter into research as well as STEM careers, and then addressing the inequities in access and quality of care. A statistic that I shared with you earlier, 240% higher for women that are African American. That is a big number that we are working very hard to reduce. And one of the ways that we do that are through different awareness campaigns. I do an event called Go Right Girlfriend that's specific for the African American community. We've done that for about 12 years now. And it's events like this partnering with our national strategic alliances, like Delta Sigma Theta, Sorority Incorporated, and coming out and sharing information about the risks, as well as all the great things that we can do, that we have control to make a difference in our own heart health. So the warning signs, do you know what they are? So know the warning signs of a heart attack and a stroke. A lot of times when we think of a heart attack, we think of what we see on TV. You know, it's pain to the chest and then you kind of pass out. Well, there are more symptoms for women than there are for men when it comes to having a heart attack. You know, the typical symptoms are nausea and vomiting. That could be one, you know, some of the symptoms. Jaw, neck, or upper back pain. You could have some chest pain. But for women, it's very interesting because it could be pain in the chest that radiates to the back, or pain in the back that radiates to the front. You could also feel pressure in the upper or lower chest or in the upper abdomen. You can have shortness of breath, fainting, indigestion, extreme fatigue. And so when we see all these different symptoms, you know, they sound like very common symptoms, but when you're actually having a heart attack, they're going to be extreme. So it'll be extreme nausea, extreme dizziness, extreme jaw or neck or upper body pain, extreme chest pain. You know, it'll be something that you'll know that something is very, very wrong. And so we just want to make sure that women are aware of what those warning signs are. Same thing for stroke. Stroke, the warning signs for a stroke are also different for a woman than for a man. You know, we all know fast, you know, where looking at the face, right, for face drooping. We all know arm weakness. You know, you could have an arm, one arm or the other could be weak. And we know speech difficulty. But there can also be some other symptoms that we may not be aware of. Vision problems, if your vision becomes blurry. Trouble walking or lack of coordination, severe headache without any known cause, just general weakness in the body, disorientation and confusion or some sort of memory problems, extreme fatigue, and again, extreme nausea and vomiting. All those could be signs of a stroke in a woman. So in this illustration, we do show the different symptoms, and let's just look at them again. For women, you can see the list, it's much longer than that of a man. And so that's why it's very important that we are aware of our bodies. We are aware that something may be going on and that we seek help. So the last part in FAST is T, time to call 911. If you think that you're experiencing any of these symptoms, whether for a heart attack or a stroke, and they are extreme, you need to get it checked out. Either have someone take you to the doctor emergency room or call 911 to get assistance immediately. So maternal health, we have a focus on maternal health this year, making sure that women are aware of what they need to do before they get pregnant, while they're pregnant, and then postpartum. We want to make sure that we're keeping moms to be and new moms safe and healthy. So we have lots of healthy tips, which I'll be sharing the links to all of these after my presentation, so everybody will have access to this, of what to do before you get pregnant, what to do while you're pregnant, making sure that you're monitoring your health, you know, you're taking your medications as prescribed if you're on medications, that you're reducing stress and managing anxiety. We want the baby to be born, you know, calm, safely, and taking any extra precautions, especially if you happen to become pregnant if you're over 35. And then in and around the delivery, you want to make sure that you're watching for any changes and take action. You know, if there's any concerns, please let your physician know. But the most important thing is blood pressure. We want to make sure that you are checking your blood pressure on a regular basis, because it is during pregnancy that you can develop high blood pressure, also known as preeclampsia. And so that can have a long-term effect post delivery. So we want to make sure that you're checking your blood pressure and reporting your numbers in between visits to your physician. And then after your delivery, we want to make sure that you make your health a priority. Continue to get medical care, making sure that you're monitoring not only your physical health, but your mental health. You know, a lot of times, sometimes moms go have a little bit of depression because they're just so overwhelmed, you know, new baby, being back at home, maybe the demands of the house, and maybe working or whatever. You want to make sure that you maintain great mental health, and then just find simple little ways to get active when the doctor says that you're ready to exercise. And then we want to make sure that you're eating nutritious food. And if you need help, guess what? We have our support network that's here to help you in any way that we can. So again, we just want to make sure that new moms and moms to be are doing all that they can to have a healthy pregnancy and healthy delivery. So why is it important? Maternal death. Unfortunately, maternal death in the United States of cardiovascular conditions is the leading cause of death during, shortly after pregnancy. Almost 2/3 of these deaths could be prevented. So there's 4 key risk factors. Age, obviously, the older we are, it increases the risk of not having a good outcome for anybody over 40. So if you look at the statistics, that's almost 82%. When we look at race and ethnic disparities, among Black women, we're looking at 42.8% of maternal deaths are from this ethnic group. And then high blood pressure, or hypertension rates, they increase during pregnancy and have an increased chance of being hospitalized, for the delivery because the blood pressure goes up. So we talked a little bit about preeclampsia, which is high blood pressure with the signs and problems in organs such as the kidneys and the liver, and eclampsia, plus new onset of a seizure. So we want to make sure, that's why it's so important. We don't want anyone to have a stroke or a heart attack while they're pregnant or during delivery. And of course, obesity is a major risk factor that could account for nearly 1/3 of steep increases in US pregnancy-related deaths. So it's very, very important that we maintain and know what our body mass index is, especially if it's 40 or higher. That is a very high risk factor that we need to work with our care team to see what we can do to bring that down. So we've talked about women, when in the early years, when they are looking to grow their family. But as we know, a woman has many life cycles in terms of our physical health. And when we get a little older, we go into menopause. So we're going to talk a little bit about what can happen during menopause and that change of life. When a woman goes through menopause, it can be influenced by many factors. There's actually 3 stages of menopause. I didn't even know this myself. I just thought it was you just go into menopause. But actually, there's 3 stages. Perimenopause, which includes the most symptomatic years, the key times for a woman to reduce their cardiovascular risk of having a heart or stroke event. So it's very important that we know that when we're going into perimenopause, because that's when we can actually take action to reduce our risk. And of course, then there's menopause, when a woman's period stops permanently, which is 12 months in a row without any menstruation. And then postmenopause, when women spend up to 40% of their lives postmenopausal or after menopause. I know that I get my hot flashes, and that's one of the common symptoms that we see, but we also need to make sure that we are checking our blood pressure, because as our body is going through all these different stages, our hormones are also fluctuating. And it's in these fluctuations that there could be a potential risk for having either a heart attack or a stroke. So it's very important that we learn to read the signs that our body is sending us. So what are the cardiovascular risk factors? We have a decline in estrogen levels, those hot flashes and night sweats I talked about, depression, sleeping problems, can't sleep through the night, increased body fat around our organs, increased cholesterol levels. So it's very important that we get our labs done. Suffering or weakening of the blood vessels, they lose their elasticity. And then decreased risk of metabolic symptoms, which is, getting diabetes or having high cholesterol, or, having a larger waist circumference. So it's very important that we know what our waist circumference is. And of course, the threat of blood pressure increasing. So we want to make sure that you get plenty of exercise and physical activity, that you're eating healthy, that you're quitting to smoke, and that you know your numbers: blood pressure, body mass index, cholesterol, and blood glucose. We can do this together. I know that we can. Reclaim your rhythm. Yesterday was National Wear Red Day, and so We're asking everybody to move to the groove for mental well-being, put on your favorite tunes and start getting up and moving and get those extra steps. Keep track of your blood pressure and learn how to do the two-step. And I don't mean to dance, I mean learn how to do CPR, how to save a life. CPR is important as well, that we all learn how to do those 2 steps to save a life. There they are. The first step is to call 911, get help, push hard and fast in the center of the chest. And here are some simple tips on how to check your blood pressure correctly. So again, as I wrap up, be aware of your key numbers: body mass index, blood pressure, total cholesterol, and blood sugar. Next slide, it may not be working. Oh, there it goes.
As a nurse and a survivor, I encourage you to know your numbers. Know you, know your body, be aware of what's going on with you, and know what those important numbers are. Blood pressure, your blood sugar, your total cholesterol, and your body mass index. It's a matter of being persistent, but it's a matter of you being in charge of your health.
So make those moves today so that you can have a tomorrow. Thank you so much.
Okay, thank you, Veronica, for a very informative presentation. I hope you all reclaim your rhythm, get moving, learn the 2 steps, and do your blood pressure controlling at home. Now we're going to move to our healthy food demonstration, and introducing our presenter will be Yolanda Chapman, and she is a committee member for physical mental health and for Charitable Partners. Yolanda, I'll turn it over to you.
Good morning. Well, Clara Walker. Clara Walker is the Family and Community Health Extension Agent in Waller County for the Cooperative Extension Program at Prairie A&M University. She provides programming to the underserved and limited resource citizens in Waller County. She presents on emerging family issues, including cyberbullying, social media, child passenger safety, parenting, grandparents parenting again, and conflict and anger management, as well as childhood obesity, and health and wellness topics for seniors, adults, and youth. Clara is a native of Waller County and has extensive experience in the field of money management. She received her master's in human science and her BS in criminal justice from Prairie A&M University. While working on getting her master's, she hosted numerous educational programs for the freshman population of Prairie A&M University that taught students the definition of consent. Clara is passionate about her continued service to the members of the ever-changing Waller County community. Without further ado, let's welcome Clara Walker.
Good morning, everyone. Is my audio fine? Just double checking.
Yes.
Audio's good. All right. That was a great presentation with such good information from Ms. Sanchez. I'll just piggyback right off of her. Heart disease accounts for nearly 1/3 of deaths worldwide, and that's major. They call it the silent killer, you know. Our diets play a major role in heart health and can impact our risk of heart health disease, okay? And Ms. Sanchez gave a very important fact that us as minority women, we're already at a disadvantage. So we need to really make sure that we're watching what we're putting into our bodies. Today, I have for you all a salad kebab, something very fun, light, refreshing, easy, always easy. You know, I'm gonna always give you something easy because we're working moms, we're working sisters, daughters, wives, girlfriends. So we're on the move, we're on the go, we're trying to get things that are good for us into our body, and we're trying to make sure that we're making it quick. Just to give you a list a quick list of things to be mindful about that we should be putting into our body that are going to be heart healthy for us. That's going to be our leafy greens, our whole grains, which include whole wheat, brown rice, oats, rye, barley, quinoa, berries, our avocados, fatty fish, fish oils, walnuts, beans, dark chocolate in moderation. So that's less than 6 servings per week. Tomatoes, almonds, seeds, garlic, olive oil, and green tea. And in our recipe today, we have at least 3 things from that list. And I can easily add 2 more ingredients to improve this recipe already. We can add seeds to it and we can add avocados. So our ingredients for today are 2 boneless, skinless chicken breasts, 6 boiled eggs, 1 cup of cherry tomatoes. We have 6 strips of bacon, or we can forego the bacon. We can forego the chicken too, just in case we have any vegetarians. 2 cups of cubed Kobe Jack cheese, 2 tablespoons of cracked black pepper, 1 teaspoon of garlic powder, celery salt, and onion powder, 1/2 cup of light ranch dressing, 1 head of washed lettuce, and 10 skewers to make this recipe. So what we're gonna do is we're just gonna start assembling. I have eggs here, boiled eggs here. We got our tomatoes. I've warmed the chicken here. We got our cubed Kobe Jack cheese. I've already been assembling here with my lettuce. And you're just gonna take your lettuce, fold it, cut it into squares, and it slides right down on that skewer. Simple, easy, quick. You slide your cheese down. You get entertained with this recipe. You're gonna get your chicken. This could be a snack for you, for your family. It can be more filling. The more chicken, the more protein you add, of course, it's gonna be more filling. So it can even be a meal. Slide your tomato down. I cut my egg in half so that it stays better on the skewer. And I just slide it on the skewer just like that. And it'll hold a little while. And I repeat, lettuce, cheese again, my chicken breast cube, and I'll finish off with a cut tomato. I won't put another whole tomato on there. And it's to your preference. Towards the end, I like to drizzle my cooked bacon on top of that. Put a little bit of that cracked black pepper. And we'll drizzle some light ranch on top. And this could be dressing of your choosing. You can forego the dressing. You can do regular ranch. You can do Italian. I know G. Hughes makes a great sugar-free. Most of his things are sugar-free, and they're gonna have a little bit more protein in it. For those of you that count macros, and that's it, quick, easy, fresh, light. I know we're waiting for questions to the end, right? So I'll wait for questions. If you have any questions, write them down and then we can fill them in the chat. That was simple, quick and easy. And we're gonna be full and heart healthy. Thank you all.
Thank you, Mrs. Walker, for showing us such a simple way and healthy way to prepare. You know, it's really a salad on the stick, which is a very convenient way of preparing. So we appreciate that new way of preparing our salad.
Thank you, Clara. As usual, you always have a lively presentation and some great ideas, especially for those of us who want to have a healthy snack. So now we're going to move to our next portion of the program. As I mentioned, social action is what we do with Delta Sigma Theta. And we're going to be talking about the work that the American Diabetes Association does and around, excuse me, okay. We're going to talk about the work that the American Diabetes Association does. And I have the pleasure of introducing our speaker for this segment. We have Veronica de la Garza. Veronica has been with ADA for 18 years and is based in Austin, Texas. Her territory covers 10 states, including Texas. She has over 22 years of experience working in the national and statewide levels in government affairs. At the American Diabetes Association, she has worked with many diabetes advocates, and together they have had successes in the areas of access to adequate and affordable health care, diabetes research and programs, discrimination, coalition building, and working with advocates in addition to other priorities of the ADA. So without further ado, I present to you Veronica de la Garza.
Good morning, everyone. Kim, can you see me?
Yes, I can, Veronica.
Okay, good. Good morning, everyone. So I guess today is Veronica Day for presentations. And also, Veronica Sanchez, you did a great presentation, and the food was amazing, and I'm hungry now, and I'm gonna try and make that recipe today. So as Kim said, I covered 10 states, including Texas, and we're gonna discuss now advocacy and policy at the ADA. We first start with our mission. Next slide, please. Which is to prevent and cure diabetes and to improve the lives of all affected by diabetes. And we have 3 priority areas: equity, access, affordability, food and nutrition, and research and innovation. Under the equity, access, and affordability priority, we work to reduce the costs of and the payment barriers to diabetes drugs, health insurance, hospital care, and devices, boost access to quality healthcare providers, break down systemic barriers to equitable diabetes treatment, care, and prevention for children and underserved populations. Next slide, please. And in the area of food and nutrition, we work to improve the quality, availability, and affordability of healthy food and drink for children, low-income Americans, and others at risk for diabetes. We promote culturally appropriate resources and education to make healthy food more accessible. In the area of research and innovation, we work on ensuring a robust US commitment for research into diabetes treatments and cures, and then to address gaps in clinical trials for people with diabetes, and to promote access to safe and effective medical innovations that will improve the lives of all people with diabetes. A key area of our work is our efforts to make insulin affordable for all. Insulin is a matter of life or death. Insulin isn't optional. The price of insulin rose dramatically during the past 2 decades, nearly tripling between 2002 and 2013, and continuing to rise since then. We need to make insulin affordable for everyone who needs it. ADA conducted a study in conjunction with other partners and found that insulin affordability impacts people's ability to manage their diabetes. The study found that 1 in 4 insulin users said cost has impacted their insulin use. 36% of insulin users choose between insulin and other medications. 30% choose between insulin and utilities. 27% choose between insulin and housing. 26% take less than prescribed. 23% miss doses weekly. And also 23% switch to less expensive brands. In the next slide, I will share some of the steps ADA has taken to address this issue at the federal level. ADA raised the profile of the insulin affordability crisis with members of Congress, leading to hearings, reports, and increased media exposure for this issue. A new option was created for the federal Medicare program for seniors and the disabled, providing the option to choose plans with $35 monthly insulin copays. So I left the information about the Build Back Better bill in the presentation because that's technically still being considered in Congress. The legislation passed the House and is in the Senate, and news reports in the last week or 2 have said that the bill is dead. But I did want to mention that the legislation covers many areas of policy, including health policy. There are numerous provisions addressing health insurance and drug affordability, and it includes a proposed cap of $35 on insulin per month that would apply to prescription drug coverage for seniors and private health insurance plans. So we hope that that piece of Build Back Better finds its way into maybe another bill at some future time this year. And so now I wanted to talk about efforts at the state level. In 2019, Colorado passed the first insulin copay cap applying to commercial health plans. These are the plans that states can regulate. Since then, copay cap laws have passed in an additional 19 states and Washington, D.C., helping to improve affordability and helping to drive the consideration of caps at the federal level. Other laws were also passed, including more affordable insulin for the Utah public as negotiated through their state employee plan, and then legislation requiring manufacturers to provide low-cost insulin either for an emergency supply or throughout the year for those facing affordability problems. And these laws passed in Minnesota, Maine, and Colorado. And this year, well, 2021, I still am saying this year, but we were thrilled to pass an insulin copay cap law right here in Texas, a $25 cap on monthly copays per prescription. And next, I wanted to touch on health insurance access. While insulin affordability is a core problem for many in the diabetes community, too many people with diabetes face even broader issues with access to care, inclusive of their medication needs. The COVID-19 pandemic has highlighted these difficulties and disparities. ADA called on elected officials to work to address health insurance coverage to support people with diabetes in maintaining their coverage or gaining new coverage in the face of the pandemic. We also called for improved access to testing and for access to vaccines once developed, given the vulnerability that people with diabetes have to the virus. Continuing our work on improving health insurance access, the American Rescue Plan, which was passed earlier in 2021, provided critical support for accessing health insurance coverage during the pandemic, including improved eligibility and subsidies for marketplace health plans and funding to allow people to stay on COBRA plans with no premium cost. States that had not expanded Medicaid, as is the case with Texas, were also incentivized to do so. And now some of the temporary supports that were enacted in the ARP could again be further extended under the Build Back Better plan. So these include new subsidies for accessing marketplace plans that are targeted at helping people who would have qualified for Medicaid if their state had actually expanded Medicaid. And I just want to, for a second, say that we have, there is efforts underway in Washington, D.C. right now to take some of those healthcare provisions that are in the Build Back Better plan and put them in other places, not just the insulin copay. So hopefully we will see some of these efforts come to fruition. ADA continues to push for access and affordability, and the pandemic has only further highlighted the disparities in access to care across our country, including great differences in health outcomes. To provide further focus on these issues, the ADA launched our Health Equity Now campaign and its related Bill of Rights, detailing some of the areas most needing attention. And you can find this information at diabetes.org/health-equity-now. In November of last year, we held a cost of care summit to help address affordability and barriers across the spectrum of care needs for all people with diabetes, whether medication, devices, or healthcare services. In the area of research and prevention, ADA continues to advocate for funding in the annual U.S. budget to address diabetes prevention work led by the U.S. Centers for Disease Control and Prevention, diabetes research towards a cure and improved care led by the U.S. National Institutes of Health. We also advocate in support of a 3-year reauthorization of the Special Diabetes Program that passed last December. It provides $150 million in annual funding for type 1 research and $150 million for improved diabetes prevention and care for Native Americans, which is the population with the highest prevalence of diabetes. And then I did want to mention our Safe at School campaign, which works to make schools, daycares, camps, and other programs safe and fair for children and young people with diabetes. We equip families, school personnel, diabetes providers, and other caregivers with resources, education, and training to ensure that schools can safely meet the diabetes care needs of youth with diabetes. And now we are going to turn to the Texas diabetes-related advocacy wins achieved with ADA support during the 87th regular session. The first, of course, is the insulin copay cap legislation, which caps insulin copays at $25 per prescription for a 30-day supply. The sponsors for this bill were Chair of Senate Health and Human Services, Senator Lois Kolkhorst, and State Representative Eddie Lucio III. The legislation had broad support from both the House and the Senate, and Governor Abbott signed it in June. It will apply to state-regulated policies next year. I also wanted to quickly go over some other legislation that may be of interest. HB 18 by Chairman of the House Insurance, Tom Oliverson, establishes a program for Texans without health insurance where individuals will be able to purchase some prescription drugs at the post-rebate price. HB 4 opens up the option for Medicaid recipients to receive telehealth services. HB 133 continues postpartum coverage for 6 months, an important benefit for those with gestational diabetes. HB 1935 gives pharmacists the authority to dispense a 30-day emergency insulin supply. HB 2509, that was one of the last pieces needed to establish the first podiatry school in Texas. HB 3459, which streamlines prior authorization requirements and removes some barriers for certain services. All in all, it was a very good session for diabetes-related legislation. And then we end with actions that you can take to support advocacy. Act on ADA action alerts by sending our template emails to your legislators to urge their action on policy issues important to the diabetes community. You can also write a letter or make a phone call. You can advocate with legislators through social media, and we sometimes include template language for doing so in our alerts. And this is how you can sign up to become an advocate if you have not done so yet. diabetes.org/advocacy/become an advocate. You can also sign up to become an advocacy influencer. And those advocacy influencers are people who want to make a deeper commitment to advocacy, to do more than act on action alerts. This may include being invited to meetings or town halls, or being asked to engage with the media to lend support. And then the last slide is just our engagement platform, my email if you have any questions. And I appreciate the time today, and I appreciate the invitation. Thank you so much.
Thank you, Veronica. As you all know, when we go to the polls and we vote, it doesn't stop there. We need to hold our elected officials accountable to help organizations like the American Diabetes Association push the envelope to get bills passed to help with our health care. So now we're going to come to part of our program. Since it's a great segue in speaking about insulin, we're going to have Know Your Medicine and Vaccinations. And introducing our speaker will be Forrest Bars, who is a committee member of the Charitable Partners Committee.
Good morning, everyone. My name is Forrest Bars, and I will be introducing Know Your Medicine and Vaccination presenter, Dr. Junius Keith Powell. Dr. Junius Keith Powell is a 1988 graduate of Lincoln High School in Port Arthur, Texas. After graduating, he accepted a mission to Prairie A&M University, where he received his bachelor's and master's in biology. Upon completing his initial education, he took a path which led him to apply and be accepted into the College of Pharmacy at Texas Southern University, where he received his doctorate. Dr. Powell is a pharmacist in charge of Berkshire Brothers Pharmacy in Waller, Texas, and is a professor in the Department of Biology at Prairie A&M University. Outside of work, he's a member of the National Society of Collegiate Scholars, Omega Psi Phi Fraternity Incorporated, and a member of Fallbrook Church. Dr. Powell has been married for 26 years to Sarah Donna Powell, and they have 2 children together. Let us welcome Dr. Powell.
Hello, good afternoon. Can everyone hear me?
Yes, sir.
Good, thank you. Thanks again for that awesome introduction. Thank you so much to the ladies who have presented. Thank you, Delta, for allowing our community and our constituents to have some insight in our heart-to-heart. Thanks for allowing Brooks and Brothers to be a part of your community as a pharmacist and a pharmacy caregiver, community grocer. I'm located in Waller, Texas, just near the on 2920. If anyone ever needs to come over to the pharmacy, it is an standalone pharmacy, so it's a part of the grocery store. We are a part of the chain of grocery stores. We're just an standalone pharmacy, so you won't see the entire grocery store there. It just will be the pharmacy. But I will speak on knowing your meds to Ms. Veronica, both of the Veronicas, Ms. Walker, Ms. Sanchez again, and Ms. De La Garza. Thanks so much for that insight into the American Diabetes Association, the cardiovascular side, and then the food ideas. I'll speak a little bit about the vaccines, and then I may mention some about the diabetic supplies. As you know, the federal government has given some emergency authorization uses on Moderna, Johnson vaccines, and the Pfizer vaccines. I have the Moderna vaccine, and I've got the Johnson. Our pharmacy was able to obtain both these vaccines. We were able to store them. A big part of the vaccines were storage. We were outfitted with some refrigerations and freezers that gave us the capabilities of storing these vaccines. We started them last season. I think as we turned the calendar in 2019 or 2020, we started the vaccines December 2020. As we went into 2021, there were some additional variants that came out. At first, it started with Theta, and then Iota and Kappa. Those were some variants of interest. Of course, they would change these receptor binders. This is what these variants do. They bind to these receptors and they neutralize the antibodies. And so as these variants neutralize the antibodies, they of course decrease the efficacy of some of the treatments. Now that's a problem because if you're treating these bugs, well, we call them bugs, they're microscopic bugs, but if we treat these bugs and you start to lose the efficacy, then the bug seems to start winning and some of the signs and symptoms return themselves. And part of that is to these variants, as you decrease those binding sites, you increase transmissibility. That's the hugest part of these variants is transmissibility. Of course, the severity of some of the signs and symptoms follow that. But we started with Moderna, which had a 65% efficacy rate and with the first dose. And then we went to the second dose, which gave you about another 35%. So it put you at about 95% as we initially started those vaccines. Johnson was a one dose. We were able to give the one dose, one boost, put places at about 65% of efficacy. And the common flu shot or the annual flu vaccine that we administered, it's about 65, 70% efficacy. So Johnson was pretty much right in line with what our annual flu vaccine had been giving us as far as safety and health ideas. Moderna was a little better as far as the efficacy rate. Pfizer did list itself at about 93%. So Pfizer was also a good vaccine to have administered. All the vaccines are good. Of course, the benefit outweighs the risk. I was able to administer these vaccines in some special populations, meaning gestation. If the lady was expecting, I was able to, a general or a physician did recommend that the vaccine still be administered, although she was gestational, just a few months pregnant. I've given that vaccine to a feeding population. The lady was feeding, and it was still the benefit outweighed the risk for the feeding population. So that question came, she's like, well, I'm feeding, could I still receive this vaccine? Her attending, again, the physician did, we spoke and we collaborated, and the benefit outweighed the risk for the gestational lady and the lady who was feeding. The next population that seemed special was chemo. I had a couple of patients that were on chemo at the time. They were receiving the vaccine. And as you know, some of the chemo regimens seem to eliminate, if you will, all drugs, everything that's inside your body, good cells, bad cells. The chemo seems to wipe it all out, hopefully all the bad cells. So the patient was wondering, should I have chemo, the vaccine administered? I'm going to be receiving chemo in a week or the next week, or I'm going in for another treatment. But again, the oncologist did prefer the vaccine on board in between the chemo regimens. So for just about all populations, the vaccine was accepted or acceptable to decrease the risk of severity. There's some other populations that are more susceptible, of course, with underlying conditions. You would understand that certain populations would be a little more susceptible to succumbing to the bug, the corona bug. But again, these vaccines are safe. There's some pain at the injection site. Certainly at the injection site, you can receive that. There's no headache usually that follows. Sometimes you can receive a headache, nothing on the GI. In the lymph system, these vaccines seem to affect the lymph system. So if you were to do a BSE or a breast self-examination, of course, it's not here, the examination's here, because the lymph system follows the cardiovascular system. Just as the arterioles fall, the lymphatic system falls just next to it, and it absorbs about 15% of the fluid that gets out of your cardiovascular system. So your lymphatic system picks that fluid up and returns it back into the heart through the subclavian. Now, in the lymphatic system, you can feel a little nodule or a little knot or a bulge. Don't think that it's a staph infection or it's not a boil or anything staphylococcus. It could just be the response from the vaccine moving over to your lymphatic system. That's also your immune system. So your immune system picks up these vaccines also. So if you did a BSE or breast self-examination, be aware that if you just received the vaccine, like you don't have that lump, that's not the lump that you could be experiencing. But certainly you could feel a nodule from these vaccines. They do affect the lymphatic system. Again, I think they are highly effective. I would recommend them. The booster, the third dose, what happens in some of these, after you see the first dose, the second dose, it seems to, after maybe 3 or 4 months, seems to lose some of its effectiveness or efficacy. So the boost returns that variant or the effect of the vaccine back to 75 or 80%. So as it decreases in time down to maybe 40%, the boost puts you back at the 75 or 85 percentile where you can have something to fight against the bug. Now, will we ever be involved again in a 4th dose or an additional boost? Not yet, but there are some emergency use authorizations that are out there that we may end up in an annual vaccination. Certainly like the flu shot is an annual vaccine. The COVID, Moderna, or the COVID vaccines may be annual. Children have just been invited into the vaccine population. Less than 18, I think Pfizer had been the only manufacturer that was able to test and administer meds less than 18. I think 16 years old was the age for Pfizer. Moderna and Johnson hadn't reached that vaccine population yet, but I think the emergency use is going all the way down to 5 years of age. So they may start administering this vaccine to children. It's probably going to be a lower dose. They are less severely affected, but they are affected and it's transmissible into the other household members. So that's sort of the precaution that's out there with the emergency use authorization handed down by the federal government and at the state levels to try and mitigate the chance of transmissibility throughout the entire household. So it is safe for children. It's what the record appears to be saying now. But as far as an adult is concerned, if you are going to move around in certain populations, if you get into closed areas, I know we still wear our mask and we still take our precautions with our hands. Wash your hands at the top of every hour. If you're in a facility or if you have a job that allows you or a place to wash your hands at the top of every hour, wash your hands. Just if you can keep that as a practice, just go and wash them and have some lotion or something near you. But definitely use the vaccine or get the vaccine. It's safe. It's safe. If you've got any underlying conditions, asthma or any respiratory idea, you certainly want to be a part of diabetes or anything that could compromise your respiratory system, then the vaccine is important. There are some meds that are used that are off-label use. Hydroxychloroquine has been out there. I have administered or dispensed hydroxychloroquine, the 200 milligram tablets. I've dispensed ivermectin. You've seen that kind of make the news. Ivermectin. These are anti-malarial or anti-helminthies, or sort of warmers in the cattle industry. But they have shown some effect against this bug. The ivermectin, some of the third parties are no longer buying the ivermectin, so there's no reimbursement there. So you're gonna have to cash out on ivermectin. It's expensive. It's $300 for 10 tablets or 40 tablets, and you may have to eat 5 or 7 a day for 5 days. So it's an expensive regimen. However, there have been some work that shows that is effective against the bugs. So ivermectin's out there, hydroxychloroquine's out there, and then the vaccines are out there. Again, make sure you wear your mask still if you're going to get inside of an elevator, or you're going to get into cars that everyone's maybe not protected, or anytime you get into any closed area, try to wear your mask. And if you're going to be in an outside area, then it may not be as imperative. But again, the mask still does help. I am still in favor of the mask, and I'm still in favor of the vaccines. I think the benefit outweighs the risk. Just as the Ms. Clara was mentioned and Ms. De La Garza, the American Diabetes Association is huge. It's a big part. That's one of the largest underlying conditions that we've got to be aware of, are comfortable in understanding as we go through these vaccine bugs. Diabetes is expensive. It's expensive to treat. These insulins are so expensive. Ms. De La Garza was dead on mentioning that the cost, I've got patients that have to weigh what are they going to do this month. I'm going to buy my insulin, I'm going to buy my meds, I'm going to pay my mortgage, I'm going to eat, it's always a debate for insulin. I've got some pens, these Libre system sensors are there, the one touch, make sure you get a glucometer. If you need a glucometer, check your A1Cs. There's Novalock, there's all kinds of insulins that are out there. They are expensive. The pens are a little more compliant. It's a little easy to inject the pens. These are once weekly. There's no more pricks on your finger. You no longer have to do that pricking. You can prick your finger using the old test strips, and glucometers are test strips and Lancets devices, but most of the patient population has moved over to pens, some kind of insulin pen, and are a Libre sensor where the sensor stays on it pins in. You can shower, you can do whatever you need with it. And it just pins on every 14 days, you replace the pin, and you can use your phone. There's some apps on it, and you just scan the sensor with either a monitor or your phone's got these apps. And the results, the A1C is pretty much what everyone's looking for. They return right to your physician. So your results go to your doctor. So it's an easier way to test your blood glucose levels. That's an important parameter. Keep up with your hemoglobin A1C, keep up with that parameter for sure. It's a cardio-renal idea. I know Ms. Veronica mentioned in the heart part, the cardiologies of it. Your renals are huge. Protect your kidneys, definitely protect your kidneys. Hypertension's got a lot to do with the kidney, Everything's renal. Protect your kidneys if you have any chance of staving off hypertension. The heart's a muscle, but the kidneys are what's really driving the high blood pressure. So if you can keep that kidney intact, using some vaccines, making certain you use the foods that Miss Veronica, I think Miss Miss Walker did mention, that salad on the stick, that will help. Definitely incorporate that menu or some foods that can help lower that blood glucose level, the hypertension level. Think of something holistic. And if you can, receive a vaccine. If you haven't been vaccinated, go over it and try and receive a vaccine. I think it does help. I am an advocate of the vaccine. Again, I think the benefits outweigh the risk. Moderna is 2 injections. The Johnson's 1 injection. Pfizer is 2 injections also. And then there's a boost that can accompany it if you prefer the boost. The boost is only half the dosage of the first and second dose. The boost is only half dose. The first doses were 0.5, just a half cc. And then the boost are 1/4 cc's. So they're down to 0.25 mils. You still get the same injection. You still have to administer the med. But if you're at any debate on the vaccines, they are safe. The vaccines are safe. I will say that they are safe. We've been in vaccines for a long time. So this is not a new sort of safety. If you can add a different vaccine, add your shingles vaccine, add the pneumonia vaccine, but definitely get the shingles. Shingles is after 50 years of age, you're going to want that shingles vaccine. There's chickenpox when you're 5, there's shingles when you're 55. So definitely look forward to that varicella zoster, or get your shingles vaccine, get your pneumonia vaccine. Pneumococcal got 23 variants, and we definitely want to prophylact ourselves against pneumonia and shingles. If there's any questions, I'll be with you guys, ladies, at the end of the seminar to answer any questions on the vaccine. Again, thank you, Delta, for having Brookshire Brothers be a part of your community and allowing us to be a part of this program. Thank you so much, moderator.
Thank you, Dr. Powell. Thank you, Dr. Powell, for a great presentation. We go get up out of our seats and get moving with a stretch break. And facilitating that stretch break will be Rolton. She's a Zumba instructor and is also a member of the Global Partner and Physical Health Committee.
Okay, here we go. So everybody, thank you all for being here and joining us today. I hope you have enjoyed the meeting so far. As Soror Rucker said, we're going to stand up. We're going to get moving. So everybody up. I can see you now, so I need you up. Can y'all hear me?
Yes, we can hear you.
Okay. So good morning again. As Ms. Sanchez mentioned, part of your cardio health is physical activity. And I know it's hard sometimes getting out, like it's been so cold. I didn't want to go outside, let alone go to a gym and work out or anything like that. So there are things you can do at home just to stretch your body out, get your blood flowing, get your day going. So today we're going to do a 2-minute stretch. Since we've all been sitting, we're going to get up. We're going to start off, we're going to work our body from our head down to our toes. We're going to give everything a good full body stretch today. So to start off, we're going to stretch our necks. And what you're going to do is you're going to take your right hand, you're going to put it to the side of your head. You're going to keep your left hand down to your side. You're going to give it a gentle stretch. And you're going to hold that for 5, 4, 3, 2, 1, and bring it back up to center. And we're going to do that on the opposite side as well. Hands to your head and stretch. 5, 4, 3, 2, 1, and release. Let's do that 2 more times on each side. And what you're feeling for is for a nice stretch on the side of your neck. 2, 1, and up, and the opposite side. And again, you're feeling a nice stretch. 3, 2, 1, and up. Last time on your right. 3, 2, 1, and up. And last time on your left. 3, 2, 1, and up. All right. And now we're going to take our head front and back and release that tension. So you're going to look down toward the floor and hold it for 4, 3, 2, 1, back to center, and then lean up toward the ceiling for 4, 3, 2, 1, and back to center. Now I always come back to center because if you have any balance issues, that helps you rebalance yourself. And up, 3, 2, 1, and center. One more time to the front. 3, 2, 1, center, and up. 3, 2, 1, and center. Right? We got to move on down to our shoulders. So what we're going to do, we're going to do shoulder side stretches. So you're going to lift your right hand up, this hand to the side, and keep your feet a little more than hip width apart to keep your balance. And we're going to stretch it over. You should feel a real good stretch on that side that you're pulling. And up, I'm going to do that 2 more times on the same side. Arms up and stretch and up. Last time. And down. I'm going to do it 3 times to your right. So arm up, stretch over. I heard a pop on me. I don't know about you. Arms down, back up and over and bring it down. Last time on that side. Up and over and down. All right, we're going to move on down to our back. Sitting at the desk all day or just, sitting in chairs, we do things to our back. So let's stretch that out. I like to put my hands on my shoulder, at my side, sorry. And then we're going to lean back just as far as you can, keeping your balance. Just look up. 3, 2, 1, back to center. And what you're aiming for, take it back, is a stretch right in your lower back. 2, 1, back up. Again, lean it back. 3, 2, 1, up. And one more time. Good stretch and up. Good job. All right, we're going to take it on down to our lower body. We have our major muscles, our quads in the front, and we're going to stretch our back and our lower legs as well. So to start off with our quads, if you have any balance issues, you can hold on to the back of a chair or the desk that you were sitting at. You can put your hand flat on that desk for balance. You're going to take your right leg. You want to lean it up, grab it with your hand. And what you want to do is keep that knee pointed down to the ground. We're going to hold that for 5, 4, 3, 2, 1, and release. We're going to do it on the opposite leg. Again, hold on to the back of a chair. Put your hand flat on the desk in front of you. You're going to grab your leg, pull it close to your body. You keep the knee pointing down for 5, 4, 3, 2, 1, and down. Now we're going to move to our hamstrings, the back of our leg. So what you're going to do, stand with your feet just hip width apart. You're going to do a slight bend in your knees. Take your right leg out in front of you, with your feet flat. You're putting your weight on the opposite side. So you're going to keep the right leg straight. You're going to lift your toes toward the ceiling. And you should feel a good stretch all the way up through your hamstring and calves. And we're going to flex. So now put your feet down, flat, lift your toes up again, and do that 3 more times. Down, flex toes to the ceiling, down, flex your toes up again, and down. And you're going to lift up. We're going to do that on the opposite leg. So slight bend, lean back, your left leg straight out, feet flat. We're going to lift our toes, lower, 4 more times. Toes up, lower, toes up, lower, toes up, and lower. Now we're going to come up. Now we're going to do shoulder rolls. And why I like shoulder rolls, when I do them, you're releasing tension. We have so much tension built up in us, and that's not good for our cardiovascular health at all. So you need to release tension. So what I do, when I come up, when I release something. So I want you to do the same. You release whatever it is you need to let go of for today. So shoulder rolls up, and we're going to roll to the front. I release pain. Up, out, I release stress. I release anger. Up, I release fear. And on this last one, we're going to do together, and we're going to release me. I want to release me from all my shortcomings, all my seem to be failures, all my stress. I want to free me. So on the last shoulder roll, I free me. All right. Now we're going to do, just get some full deep breaths in and then invigorate and get our blood flowing. So you take a hip width stance. We're going to pull our arms down in front of us, and then we're going to lift stretch as tall as we can get, reaching for the ceiling, reaching for heaven. So we're going to do that 5 times. Down, up, release, and breathe. Take deep breaths as you do this. So inhale in and blow it out. 3 more. In and out. 2 more. In and out. The last one. In and out. And just in case you don't get another one today, we hug ourselves. We give ourselves love. And we are free to be happy, to have joy, to receive all that. Thank you all.
Thank you, Starella. That was very invigorating. I hope you all are stretched out, and we come to our last portion of the program today, and it will be questions that you all submitted for the cardiologist. She will be addressing those as well as providing some more information. Introducing her today will be Ruth Smith, who is a committee member of the Charitable and Partners Committee.
Good morning, good morning, good morning. Ala Watosin Fatusin was born in Maryland, but spent her early childhood in Lagos, Nigeria. She relocated to Houston, Texas, and graduated from Cypress Spring High School. She attended Baylor University in Waco, Texas, with a major in biochemistry and a minor in child and family studies. With an early passion for children's health, she attended medical school at Johns Hopkins University School of Medicine, where she obtained her doctorate in medicine. With additional interests in global health, she obtained a master's in public health from the Johns Hopkins Bloomberg School of Public Health. She subsequently completed her pediatric residency in cardiology fellowship training from Johns Hopkins Hospital. She concluded her medical training with an advanced imaging fellowship from Harvard University, Boston Children's Hospital in 2017. Presently, she is serving as an assistant professor in pediatric cardiology at Baylor University, Texas Children's Hospital. Her journey in medicine has been paved by both personal and clinical experiences that have provided invaluable lessons on perseverance, dedication, and hard work. Throughout the years, interactions with patients, trainees, and faculty at each level of training have provided unique opportunities that have allowed her to obtain and achieve her mission. She holds memberships in numerous organizations and is the recipient of many awards and honors, such as Alpha Kappa Alpha Sorority, National Pediatric Cardiology, American Heart Association Women in Cardiology Training Award, Benjamin A. Gilman Scholar, Honor P. Gold Foundation Scholar, Promoting Humanism in Medicine, Minority Research and Training Program Scholar, J.P. Grant Field Experience Award, and more. Personally, she is excited to be back home to Houston, and she is extremely thankful for all the mentorships and opportunities she has had along the way, and by sharing her experiences, hopes to provide the same guidance to others. Additionally, she married in 2021 and became the mother of a new baby boy this past January. I present to you Dr. Oluwatosin Fatusin.
Thank you very much. And that's such a warm welcome. Thank you. And this has been great. I've actually learned a lot from this as well. That, maternal health and blood pressure is just so real. And even as a physician and having to be a patient this past January, it's, I just want to stress it's really important to really monitor that, and then also be an advocate for yourself as well when you're in the hospital. If it's okay, maybe what I'll do is share my screen, or actually it looks like you have my slides on there, so we can go to the next slide. Can you guys all hear me okay?
Yes. Yes.
Okay, perfect. So briefly, just to kind of, I love the topic heart to heart, so I'm going to try to keep it as informal as possible. I'm looking at the chat as well. If there are any questions that you want to ask that I haven't highlighted, I try to answer some of the questions that were presented. And a little disclaimer, I am a pediatric cardiologist, so my focus is on congenital heart problems in kids until 21, and then congenital as they go from children to adults. So, but I do answer some of the adult questions, but I want to just put that disclaimer on there that, seeing your primary care and your adult cardiologist, if they defer on any of the things I say, I would definitely go with theirs as well. And then the next slide. So I'm a very visual person. And so, we've talked a lot about the heart today. And so I wanted to just kind of show an illustration and just talk a little bit more about it with some pictures. And hopefully we can at least all go away from here with just a little bit more understanding of what the heart muscle does. And so it's a pumping chamber, and I enjoy it because I feel like it's plumbing, and it's just directing blood flow, to the lungs or to the body. And so as you look through kind of the first few kind of graphic that's facing us in the blue is flow coming from the upper vein, so we call it SVC, and the inferior veins, IVC, goes into a right atrium, then the right ventricle, and then goes out to the lungs. So that kind of valve that's opening at the end and the blue part is the pulmonary valve, and that's taking the deoxygenated blood or the blue blood that's been used up by the organs and tissues out to the lungs to get oxygenated. Then it comes back to the left side of the heart, to the left atrium, left ventricle, which is at the bottom there. And then the aortic valve is that red valve that's opening up, and that's pumping all the red blood, oxygenated blood, out back to the organs, so to the brain, to the tissues to essentially pick up oxygen. So the simplified way is heart is a pumping, chamber. It's taking the deoxygenated blood out to the lungs, picks up oxygen, comes back to the left side, and then goes out to the body via the aorta. And you can see kind of the squeeze and motion of it, and it's very kind of predictable. So if I were to be there in person, which I do sometimes miss all the in-person presentations, I can almost tap it out, and it's very much in sync. And I'll explain that in the next slides if we flip over. And so then the heartbeat. So the way the heartbeat works, so on the left side, I'm going to kind of bring your attention to that sinus node diagram there. So there's nodes in the heart that tell it how to beat, and that's what essentially coordinates the beat to the pumping part of it. And so it sends signals out to the top part of the heart, which sends signals out to the bottom part of the heart. You can see kind of those fibers kind of getting excited of the action potential going through, and then that's telling it to squeeze. So what you get is kind of like a very, I don't know if you can hear me tapping on my desk, but it's a very synchronous motion where it's like, you can feel that. And if you were to kind of feel your pulse or put your hand on your chest and feel your heartbeat, you can almost tap it out, and it's almost a very predictable tap. And that's what we look at when we get an EKG. So that PQRST, it's just looking at one beat of the cardiac cycle on an EKG to make sure you're getting the beats go normally from the top chambers to the bottom chambers. And then that T is essentially relaxation. as it kind of resets. So what you should see on an EKG, or at least the read on the EKG, would be something called a normal sinus rhythm. So anything with the sinus in front of it is good because it means that it's coming appropriately from the top chamber. So a normal sinus rhythm, whereas you can have things like atrial fibrillation or ventricular tachycardia, which just means that the different areas of the heart are beating abnormally. And so that cardiac arrhythmia slide with the normal heartbeat, if I just focus just on the normal heart, you can see the top part contracts and the bottom part, top part, bottom part. Whereas something where you get the abnormal heartbeat, you kind of feel this coordinated movement on the heart. And what that would feel like is if you were trying to tap out your heartbeat, you would essentially not get something that's, in sync. And so as we go to the next slide, one of the questions that came was, how important is physical fitness in maintaining a healthy heart? And that was a great activity that we just did, actually, because I like that. And I think it really highlights just the importance of physical activity. I think sometimes, and I completely agree, especially during COVID, and especially with this weather, it's just, that the mental part of moving it's sometimes even harder than the movements themselves, but it does a lot. It works out the muscle itself. I just showed you the heart is a muscle, and it, like any other muscle, it requires training and it requires conditioning. And so keeping it in good condition is always good. But in addition to that, and I really love the last thing you said about, releasing the stress, releasing ourselves from expectations. I'm sure you guys can all relate as a new mom. There is a lot actually that, that comes with just life and transitioning. And it is important to just remind ourselves to release that. And it affects the heart. There is different hormones that kind of go with stress, and those hormones are, if you think about it, I think of the best way to illustrate it is, for a wild animal walked into your living room right now, your heart rate is going to go fast. You're going to feel stress, and that's a normal response to something that's, a true fear or a true problem. But having that level high all the time can be damaging when it's not under control, because then the body is essentially waiting for, and it's revving up all the hormones that should kind of make your heart go faster, because your heart goes faster because you need to run faster, etc. And so just having that high level of stress hormone can be disadvantage to the heart itself. So I put on here because I really like this slide, because I think it actually summarizes pretty much a lot of things we've heard today, which is, physical activity is extremely important, but just also, getting active, like we talked about, lowering the blood pressure, reducing stress, and watching our diet. I really like the salad on a stick illustration. I was taking a picture to try that later too, but we can see there's just a whole lot of things on here that are very helpful to maintain a healthy heart. So next question, next slide. Says, what are the 2 top risk factors for Black women that would be a surprise to us? I think before this presentation, they may have been a surprise, but after this, I feel like we can all kind of answer them very strongly. And, diet and weight, it's just so significant. When you look at, risk factors for heart disease, and you compare, African-American women and Latinas to the rest of the population, the numbers are just, scarily high. And when you look at each aspect of it that can, make it a higher risk factor for heart disease, it's so easy to kind of overlook one of these, but they tend to run together and they tend to add up very quickly. And so I think from, the presentation today, it's just taking each thing and just being intentional about them. So if I bring your attention to the slide on the left, being overweight is just higher among us women. Diabetes, there's an increased risk of diabetes, lack of physical activity, high blood pressure. Over 53% of Black women have high blood pressure. And then the next slide to the right is just another kind of simpler illustration. And the numbers are quite high. So if you have any of these two factors, high blood pressure, cholesterol issues, I know we didn't talk too much about that today, but it's also extremely important. Impaired glucose metabolism, so diabetes, you can increase your risk of heart attack or stroke by over 100%, and that's a lot, you know. And I'm thankful to be part of this presentation because I think that, you know, it's just so important. And even like I said, someone like me being in a hospital and just realizing, you know, and I'm a cardiologist, and so watching them take my blood pressure in the hospital and you know, seeing just how they can react very quickly to the numbers. It's extremely important to go in for those thinking about pregnancy or know people that are about to get pregnant to go in very optimally because things really can escalate very quickly based on that. And then next slide, please. And the next slide, I don't know. Sorry, I don't know if my screen might be frozen. I don't know if you're able to advance to the next slide. Okay. Can anyone hear me?
Yes, we can hear you.
Okay, perfect. Sorry. I was just making sure. The virtual stuff can be so hard sometimes. You don't get that feedback immediately. So what are some early signs of heart attack? I wanted to stress this. I know we had heard about this earlier in the presentation, but you know, I have a friend who's in North Carolina who recently was in the emergency room and she was complaining of some pain, and she's a physician as well. And you know, the delay in getting help for her, you know, it was just astonishing, really, that even as someone that is medically in tune, that they undermined her pain. And that struck me because, you know, a lot of times, even some of the symptoms can be vague when it comes to heart attack warning signs. But just even understanding that, you know, when I just think we have a higher tolerance for pain, and or maybe the way we vocalize our pain, but sometimes going, you know, to the emergency room or telling somebody else, it may get undermined. And so this is where we become our own best advocate. And that's what I took away from her experience, is that, you know, maybe even saying something like, my pain is a 9 out of 10. I may not look like my pain is a 9 out of 10, but I'm telling you my pain is a 9 out of 10. And being very, you know, being very strong in stating that, or in advocating for yourself, extremely important. So I do want to slow down a little bit and just talk more specifically about each of these symptoms, because I want us to focus on them, just because, you know, hearing the story from earlier and seeing how some of these may mask other symptoms, it's important to recognize them. So, you know, if you're having pain or discomfort in the chest, you know, and it's always hard to know, is it just kind of, did I pull a muscle? Did I lift something heavy? You know, if you can reproduce the pain, let's say you know, I do pediatrics. So a lot of times I have kids that come in with chest pain, but then I point right on the middle of their sternum and I push on it and they're like, my pain is right here. Then I could say, okay, maybe that's, you know, actual musculoskeletal pain. But that's in kids, you know, as we kind of get older, I think we can sometimes, it may feel like it's you know, a vague pain, but just paying attention to like, what is that funny feeling in my chest? You know, especially if it's a pain that you can't say it is right on here, then that's a, you know, a warning sign. And then, you know, we talked about pain going from the front to the back, or pain going from the back to the front. So lightheadedness, nausea, vomiting are good signs to think about. And the reason why is if the heart is essentially dysfunctional because there is any like rhythm issues or functional issues, then it can cause, you know, your brain not to get enough blood, or the gut not to get enough blood, so you can get some of those symptoms. And then similarly would be, jaw pain, discomfort, or pain in the arm or shoulder, or shortness of breath. And then next slide. And then this is important. I just wanted to speak briefly on it, and I'm almost done with my slides. Is the enlargement of the heart a serious side effect of the COVID vaccine, and should we be concerned? We have seen some cases with kids where the vaccine itself can cause inflammation around the heart. We call that myocarditis, but it's not as severe as when you don't have the vaccine. So it's not as severe as when you have the actual COVID-19 infection. And so in general, though we have seen some cases, they're milder, they tend to recover better, and they don't need the life support that we have seen some of the kids need when they are just with the COVID vaccine. So overall, we would say the benefits outweigh the risks. And then on the next slide is just, again, to reiterate that the complications from the virus itself is just so significant when you think about stroke, rhythm issues, heart attack, DVTs, dysfunction in the heart, or inflammation around the heart. The complications from the virus itself is much more significant than the mild complications that we've seen from the vaccine. And so I think for us in medicine, and those that are frontline, and those that unfortunately have had to put kids on life support for COVID, it's we still would all agree that the benefits outweigh the risk. And then next slide. And then I'll just kind of go fast through here, because I think a lot of this is, there have been some questions about pediatrics and heart defects. And so anything that you have in the walls, problems with the walls of the heart, or problems with the valves of the heart, and if you're born with it, then that's more of a congenital heart disease, which is what I focus on. And then next slide. And this was a specific question that was asked. If we can advance to the next slide. Is being born with holding your heart genetic? It is, in that it's congenital and you're born with it, and that it can be increased risk if you have a family member with a heart disease, but in general, it's still rare. It's 1%, and there's we don't know why. There's some association with some risk factors, but for the most part, they just happen on their own. And then next slide. And in signs, there's signs we should look for kids that would suggest the problem. A lot of the heart disease that if you're born with tend to present, or the significant ones will tend to present in the infancy period. And that's, the good part of that is that the pediatrician is usually watching them very frequently. And so there'll be things that you notice in terms of fast breathing, not gaining weight appropriately, puffy arms and feet, getting tired very easily. But those are things that the pediatrician picks up. So if you've survived kind of that first year without any red flags from the pediatrician, then they're usually mild heart disease that would get picked up, or generally get picked up on by the pediatrician, and then they get referred to us. And then next slide. And then I think we just have a couple more slides after this. But child weight and, so if you just go one back over, sorry. Just that's actually going to be my last slide. So, with kids too, we're seeing an increased risk of obesity. And so unfortunately that can predispose to later on complications. And so just paying attention to kind of that weight curve and their weight in general. So anything, above the 85th percentile, as you kind of go through the pediatrician and see the growth curve, start thinking about just some of the things we've talked about as well in terms of being active, diet, etc. I think that's all. The rest of the slides are just some kind of fun facts, but I think I've covered most of the questions that were asked, and I'm happy to answer more at the end.
Thank you, Dr. Tucson, for that awesome presentation. Thank you so much.
What a program we have had today, you all. If you would bear with us, couple more minutes. We're a little bit over, but we think it's been worth it. You have heard a lot of information. So now we're going to come to the Q&A session that will be facilitated by Mary McCullough. So Mary, I want to turn it over to you.
All right. Thanks so much. This has been an awesome program, and we didn't want to end it without having the opportunity to address a few of the questions that have come up for some of our visitors. So let's just jump right into it. Our first question is going to be for Ms. Clara Walker. We have a guest who wants to know about the dressing you used again. It sounds like they plan on going on and making those salad skewers, as I like to call them, when we leave here. So if you could post that for us in the chat, that would be wonderful. Our next question was for Ms. De La Garza. We had some questions about the $25 copay for insulin and if that is currently in the works or is that something that is already a thing? So Ms. De La Garza, would you like to answer that for us?
Yes, I'm sorry. I thought I was supposed to type it in. I'm so sorry.
That's okay.
Yes, it's already the law. It already happened. And so I just want to say to everybody that if you are under an ERISA plan, which is those that are self-insured companies, this law does not apply to you because ERISA plans only the federal government can have any effect on ERISA plans. Otherwise, if you have private insurance, yes, it's already there, $25.
Awesome. Thank you so much for that. We actually had two questions that was related to that. So thank you again for answering that. Actually, one of our last questions here is for Dr. Powell. Dr. Powell, we have one of our guests, Ms. Hollins, who is an aspiring physician. And she made a really great point about the negative stigmas related to the COVID-19 vaccine and how we can engage the Black community in understanding more about the vaccine and actually taking the vaccine.
Sure. Our community does seem to have some apprehensions, or we are a little apprehensive about receiving that vaccine, just from some of the historical components or aspects of what we have gone through as far as vaccinations. But I will encourage each of us to ask our family members, especially those who have maybe an underlying cause or a condition, to be a part of the vaccination process. It does help. It does help. It does decrease some of the severity of the adverse effects. Just each one, just grab your mom and your aunt and your grandmother and your uncle and your grandfather and maybe even your son who's above 16. I'm not a total favor of those who are middle school or younger because most of the times they're going to sort of be with a parent or a caregiver to kind of take them around. But after 15 or 16, you're kind of driving and doing some of your own things and you're out there a little bit more. You work or you're doing some of your own ideas. So I would just encourage each one of us to kind of protect our households. Let's just start with each house and try and make certain that everyone's at least vaccinated or under some vitamins, some vitamin C, some vitamin D, some zinc or something prophylactically to try and stave off the severity of the drugs. But definitely encourage each one of our family members to try and take care of our household and see if we can get all of us vaccinated. It does help us and everyone.
Thank you so much for that, Dr. Powell. Our last question for Ms. Veronica Sanchez. You mentioned a lot of information regarding just talking to our doctors and knowing the signs of heart disease. For those of us who may not be as comfortable speaking with our doctors or who need support in choosing a doctor, what feedback or suggestions would you give for taking those steps?
Well, thank you very much. I did put a lot of information on the chat box of some of the resources that I shared. But as it relates to finding getting a medical home or finding a physician or a practice to get care, first I would look at if you have insurance. If you have insurance, look at see what providers are a part of your plan. And then kind of go and research them, right? You look them up and see what kind of practices they have, and one, is it close to you? You know, either where you live, preferably where you live, because you're probably, when you're not feeling well, want to be able to go. But if nothing else, you know, maybe where you work. If you don't have a plan where you can look to see what providers are part of that, look for different clinics that are around where you live to see what they have. There are several federally qualified health centers and nonprofit clinics and charity clinics that can see patients that don't have insurance on a sliding scale. And some of them even see you for free based on your income. They may ask you a few questions about your income to see, you know, if you qualify. But we have several located around the greater Houston area. I work with about 184 different clinics here in the greater Houston area. So if you'd like more information, please feel free to reach out to me. I'd be more than happy to help.
Thank you so much, Ms. Sanchez. Thank you to all our presenters. Those are our questions so far. I'll turn it back over to Kim for our closing.
Thank you, Mary. So now this is the conclusion of our program. I'm going to bring our second VP, and she's also the chair of our Program and Plan Development Committee. That is Donna Powell. And she's going to provide the closing remarks for today. But as the committee chair, I want to thank you all for attending today. It was a great program. I hope you're able to leave away with something and share it with others. And go out there and wear your red and do what you can to promote good health, live a healthy lifestyle, get educated on heart disease and diabetes, as they really impact our community. So the more you know, the more you can help others.
Thank you, Sarah Rucker. On behalf of the Prairie View Alumni Chapter of Delta Sigma Theta Sorority Incorporated, I would like to thank our presenters and our guests for coming out. Thank you for always making our Heart to Heart a wonderful event. I was so happy to see everybody join and be interactive in the conversation. And as always, Sarah Rucker always makes us engaged. So that was an awesome thing. So thanks for coming, and go red for the weekend. And we look forward to seeing you all next year. Thank you.